Welcome back to Health and Home Report. I'm Larry Saperstein. Laura will be back with us in just a few moments. Did you know that failure to treat extremely low blood sugar can lead to a loss of consciousness, seizures, convulsions, and emergency treatment? While most type 2 diabetes patients recognize the importance of controlling high blood sugar, they may not know the risks of extremely low blood sugar. Here to tell us about an educational campaign aimed to provide type 2 diabetes patients with the tools to help them understand and avoid experiencing high and low blood sugar is Dr. Farhad Zangeneh. He's an assistant clinical professor of medicine at George Washington University School of Medicine, and he's joined by type 2 diabetes patient Helen Rayon. Welcome both of you to the show.
Thank you.
Thank you.
So doctor, let's start with you. Why is monitoring low blood sugar so important?
Low blood sugar is the under-recognized or under-respected aspect of management of type 2 diabetes. So low blood sugar is very important. And of course, we're here as part of an educational campaign to raise awareness on the importance of recognizing your blood sugar, and of course, recognizing low blood sugar and its impact individually on the patient with diabetes.
Okay, so what causes low blood sugar and how can you avoid it?
Number of things can cause low blood sugar, and of course, remember, we try to treat diabetes by lowering the blood sugar, but sometimes we overshoot. So certain medications can cause low blood sugar, a mismatch between diet and exercise, individual stressors, or a change in the routine of an individual with diabetes. So all of them can go into this play and cause low blood sugars, but it is very important to recognize these patterns as well as for patients to recognize their blood sugar, know what the blood sugar is, as well as have discussions with their physician regarding how to minimize these events and how to avoid them altogether.
Now, Helen, I understand you had an incident caused by low blood sugar. Can you tell us about that?
Yes, I can briefly tell you about it. I had just concluded teaching a class, and suddenly I began the sweating, becoming emotional, and highly nervous. And I checked my symptoms, and they were low. My blood sugar count was very low. I began to drive myself home, and I began to have blurred vision. And as I arrived home, I passed out on my lawn where my daughter found me and summoned EMS to rescue me. And from that, I was hospitalized.
Okay, doctor, so what can we do to avoid this kind of a situation?
Well, as Helen nicely elaborated, she described some of the symptoms of diabetes, and these symptoms can be mild, moderate, or severe. Anxiousness, feeling hungry, feeling tired, not feeling well, and of course, it can gradually increase to being confused or passing out, as happened to Helen. So I think it is important to be aware of these, and of course, to have a meter to recognize the blood sugar. But of course, too, it is important for patient to have dialogue with his or her own physician regarding these episodes. And of course, sometimes there are changes in diet that need to be made, changes in exercise, and of course, changes in medication may also be necessary to reduce these episodes or altogether avoid them, because certainly they can have a dramatic impact on the quality of life of an individual with diabetes.
I understand there is a new online program to help monitor blood sugar. Can you tell us about that?
Absolutely. There is a fantastic website recently launched by the American College of Endocrinology. It is called bloodsugarbasics.com. And I think right off bat, patients can go there, take a quiz, check their blood sugar IQ, if you will, and of course, learn all about high and especially low blood sugar. And of course, the further discussions should be individualized as they visit with their medical team regarding if they're having those symptoms, they're not. And of course, an educated patient can take care of his or her own disease in a better way. And I think this is just to raise awareness about the importance of knowing what your blood sugar is as you manage your diabetes.
Dr. Farhad Zangeneh and Helen Rayon, we really appreciate you spending a few minutes to share this important information with us.
Thank you.
Thank you.
For more information, visit hhrtv.com/basics.